Well, it's 10 o'clock, so I think we'll get started. Dr. Chen, thank you for your patience with our technical difficulties getting Zoom up and running and getting it started. I so apologize for that. I'm glad that we're able to get started. It looks like we have some people coming. We are recording this, so if you would like to go back and review it in the future. My name is Trisha Brown. I am a board member at Pet4U. I'm a physical therapist and one of the instructors. I'm also on the steering committee, and I am trying to host the education hours at least 4 times a year, possibly more, depending on the speakers that we line up. We are so excited today to have Dr. Nita Chen. She is a neurologist from Newport Neurology Associates. She has this amazing bio, but I can't do her credit and justice. I don't want to just read it. That's boring. I would like her, if she is comfortable, Dr. Chen, are you comfortable doing your own introduction and telling all about your qualifications, your fellowship, et cetera, and all of that?
Sure,
That would be
absolutely.
awesome. So I'm really excited to invite that we were able to have Dr. Chen here to take some time out of her very busy schedule. We all know that our neurologists and our movement disorder specialists are super busy, and we cannot just thank you enough for coming. The way what's going to work today is I'm going to have to turn it over to Dr. Chen real quickly. She is going to do her presentation, and hopefully there will be time for questions at the end. And I will help facilitate that. Dr. Chen, I will help watch in the chat and facilitate as all of that goes and kind of give people the opportunity. I initially asked Dr. Chen if she would speak about what sparked this conversation or this presentation is I personally had some questions about what concierge medicine was and how it fit in the role of neurology and movement disorders. And my lovely friends and people I work with in my classes that have Parkinson's disease. So I kind of started a conversation with her about that, and it expanded in this wonderful talk called Finding the Right Neurologist for You. So I'm very excited to present Dr. Chen. And Dr. Chen, if you could please do your own introduction and we'll get started. Thank you.
All right, sure, thanks. Appreciate everyone attending today. So my name is Dr. Nita Chen. I am a movement disorders neurologist. And so I was born and raised here in California, and then went to school in Albany Medical College in upstate New York. I came back to California in UC Irvine to do my neurology residency. Then I decided I wanted more training, and then so I went to Florida for 2 years to specialize in movement disorders, which largely entails Parkinson's disease. And then I came back to sunshine Newport Beach because who doesn't love California, right? All right. Okay. So I do enjoy more interactive sessions. So I may be asking the audience for questions. And if you are able to answer questions, feel free to unmute and provide some feedback. But let's just jump into it. So the title of this talk is called Finding the Right Neurologist for You. Okay, let's see if I can advance. Okay, can everyone see that okay? Okay, awesome. All right, so themes for today, we kind of cut this talk into 2 parts. So part 1 is going to be talking about choosing the right neurologist. And then the second part, we'll talk a little bit about concierge care. So what is a movement disorders neurologist? It's a little different from a general neurologist. So a movement disorders neurologist is a neurologist who has specialized training and has special expertise in the field of movement disorders. And so that's a really big term. We don't hear that a lot. So movement disorders encompass a lot of things. And the most common one is Parkinson's disease. Essential tremor is another common one. Dystonia and Huntington's disease are other ones. There are other movement disorders, but these are the most common ones that we hear about. And so the special training that we kind of alluded to earlier is called fellowship. And so that's after we've done 4 years of training in neurology. And so that's general neurology, covering all the bases of the main disorders. And then after that, neurologists can choose to go into practice or they can do specialization. And so to specialize in certain diseases like Parkinson's disease and things like that, we do a fellowship. And so fellowships have different focuses and they have different durations. Some are 1 year, some are 3 years, some are more research based, some are more clinical based. Some of the fellowships are more focused in specific diseases like Parkinson's disease, or they could be Huntington disease. So it kind of really depends on where you go for your fellowship and what you're interested in. And so that's why beyond just finding a neurologist, because that's already difficult, finding a movement disorders neurologist that focuses on your specific disease and the kind of general guidelines of that disease. So some fellowships are more focused in surgical intervention. So they really like surgery, deep brain stimulation, whereas others are more focused in genetic testing, where they do different kinds of genetic trials and things like that. Some are more trying new drugs and different clinical trials for that. And so we're all a little biased from what training we come from. And so we want to make sure that when you're looking for a neurologist, you want to find the one that aligns with what you care about and find that you can work together on the same kind of interests and specialty. Okay. And so where do we find a movement disorders neurologist? It's kind of hard just to find a neurologist to begin with. So what generally we find the most helpful is to go on Movement Disorders Specialist Finder. It's on this website called movementdisorders.org. It has international group, so not just in United States, but all across the world where we have different movement disorders neurologists who have gone through the fellowship training, who have specialized in movement disorders, and we register on this website. It's free for us to register that, I am a movement disorder neurologist. This is where my clinic is. And so you can go to the website. And so here's a screenshot of it. It shows you can click on the Browse Specialist Finder. And then you can put in where you're located and you can put what kind of patient type and see it also shows you expertise, right? So what are you specializing in? So some movement disorder specialists only want to see Parkinson's disease. Some only want to see essential tremor. Some are okay with seeing a little bit of everything. Everyone is a little different. And so that kind of gives you an idea and it'll give you a list of where the neurologist is, and where their office is and their contact information. So this can be really helpful to find a movement disorders neurologist. Okay, and so why see a movement disorders neurologist versus general neurologist? What's the difference, right? Because they got extra training, but what does that mean, right? So we've done a lot of research over the years, and what we find is specifically for movement disorders, patients who see a movement disorders neurologist versus a general neurologist, they tend to have better outcomes over time. And they tend to have more updated knowledge. Neurologists can talk about the new treatment options that aren't maybe always updated when we're doing our general neurology training. And they have more knowledge about things that are coming out. So, when we specialize in neurology, what happens is we tend to look at things that are interesting to us, right? And so we keep up to date on the breadth of general neurology, but things change really quickly, even in a subspecialty field. So it's a lot for a general neurologist to keep updated with all the new things that are coming out. So when you have a movement disorder neurologist who is looking just at what's on the horizon for the new movement disorder issues, they can give you the most up-to-date information on the new studies, new thoughts, new treatment plans, all of those things. And so we find that when our patients work with movement disorder neurologists, they tend to do better in the long run in terms of both their symptoms and their progressions and their overall kind of well-being and sense of satisfaction. And so once we found a good neurologist that works with us, that fits what our goals are and our approach in care, it's really important to have a good idea of what you're trying to achieve with each of your neurologist visits. Oftentimes there isn't enough time to talk to your neurologist. So you have to make the most of it. And sometimes you don't get to see your neurologist very frequently. So you want to make sure that, we're getting everything that we want to talk about. So the role of your neurologist is, one, to help you make the diagnosis. After you make the diagnosis is to monitor your symptoms and look for progression, right? And so a lot of times, a lot of movement disorders are very slow changing. So the progression is very slow. So we get used to how we feel and we're very good at adapting to the new norms. So when that happens, it's hard for us to tell, has anything changed? A lot of times when you come to the doctor's office, the first thing they ask you is, so what's new, right? Anything different? A lot of times it's hard for us to notice because things happen so gradually. So it's helpful to see your neurologist regularly so they can do an exam and keep track. They might notice something that's changed that you haven't noticed, or maybe you got used to because got to live your life, right? So you just adapt and move on, even if you're having difficulties. And these are great opportunities to, if your neurologist is noticing, hey, something has changed, or maybe this is something we didn't address last time, we should manage new things and talk about what kind of new treatment plans, or let's adjust some of our current treatment plans. So that's kind of the goal that you should have with your neurologist. And that comes to the question of how often should I see my neurologist? If there are active things going on, so things that are changing or you're having new symptoms, ideally you want to see your neurologist every 3 to 4 months. As many of you have experienced, things can change very quickly. And so we want to be able to get in touch with our neurologists so they're familiar with how we're doing. It's hard for a neurologist to have an idea of how you're doing if they see you only once a year, right? Because a lot of things can happen during that time. It's hard to catch up in, let's say, a 20-minute follow-up. If things are doing stable and you're feeling really good and things are going well, we often feel like, if there's no problem, we don't want to see the doctor, right? But even when things are going well, seeing your doctor every 6 months is really important. And that goes back to kind of monitoring the symptoms, because everything could be looking great, but we might have some subtle changes that's really important for your neurologist to keep track of. And it's also a great opportunity. If everything is going great, then we should have a discussion. If you have any other questions, it's a good opportunity to talk about, well, what's on the horizon, or other concerns that, maybe weren't as pressing before, but now we have an opportunity to talk about it. All right. Does anyone have any questions so far? Go ahead. I think you'd have to unmute your mic.
Yeah, when we get a new neurologist, should we ask them to test us fully and create that as a baseline so that, we can compare our future progress to the baseline when we went to the new neurologist?
Yeah, absolutely. So when we're transitioning care to a new neurologist, usually the new neurologist is going to do a whole set of exams on their own, right? Because they're meeting you for the first time and they want to know what your baseline is. That baseline may look different from the last visit from their neurologist. So it is important to ask, for that first visit to get a baseline exam. So your neurologist will be familiar with what's going on with you.
Perfect.
Yeah. All right. Any other questions so far? All right. Okay, so I'm gonna move on to the second portion. This part is going to be a little bit more interactive to talk about why concierge care, right? And so let's start with the big question. What's concierge care? We are hearing more and more about concierge medicine. That's becoming more popular in the general population. A lot of people are coming up with different models. And what we found is that every physician group defines concierge care very differently. And patients also define concierge care very differently. So if you don't mind, I open to the floor, and if people want to chime in, can you tell me what you think concierge medicine is?
So I'm having trouble finding the unmute all button. So if you would
okay.
like to speak, Zoom made some changes and I can't seem to find the method to do that, but I used to be able to do that. But if you as one of the participants have a question or want to speak and answer Dr. Chen, please just go ahead and unmute yourself by clicking on your little microphone.
Yeah.
Michael, it looks like you're unmuted. Did you want to say something?
No, I just thought I didn't know if you want to say anything.
Oh, no.
We're good.
Okay.
Okay. Yeah.
Thanks.
And if you like, you can also type in the chat if that's a little bit easier than unmuting. We have a quiet crowd today, this morning. That's okay. All right. Okay. So let's see. Okay, so let's go ahead. I'm gonna chat a little bit more about what concierge medicine means to us. Is that okay?
Yes.
All right. So from my perspective, a concierge care group is personalized care. So the goal of concierge medicine is to do what works best with the patient's life goals. And so everyone's goal in life is different. Some patients want to be as active as long as possible, whereas other patients have very specific goals in mind, like walking their daughter or granddaughter down the aisle. Or other patients' goal is they just want to see how things go, and they don't want to be too stressed about it, and they just want to live the lives they want to live, right? So everyone's goal is different, and the goal of concierge care is to make sure that whatever we're recommending, it aligns with what the patient wants. And we understand that life changes, right? So our goals can change with life. Things can happen, right? If we have the great grandbaby that's coming along, then our goals can change, right? Or we are looking to move to a new place. That can change a lot of our life goals. So the purpose of concierge care is that we're able to adapt those goals as your life changes, because life is unpredictable. And so we're here to kind of provide recommendations and help align all of those things together, and to be an advocate, that we work as a team and we kind of help bring in all of the different care that you need. So that's kind of my spiel on what I feel concierge care is. And so that kind of leads us to the question of, well, why do I want concierge care for Parkinson's disease? Because for some conditions, for someone who is super healthy and they're not really needing much, concierge care may be great, but maybe not something they're particularly looking for. And so this discussion kind of started with Trisha and me when we were talking about, well, why should we consider concierge care for Parkinson's disease? And the reason for concierge care for Parkinson's disease, I feel that it's really important to be able to make these regular comprehensive evaluation. And so with Parkinson's, it changes slowly over time, but things can change kind of unexpectedly in the background. You're not really aware of it because you're focused on living your life, which is what you should do. And so it's helpful to have your neurologist kind of be there to kind of watch and make sure things aren't changing too quickly. If there are things that, we want to make sure that we want to bring it to our attention if something is starting to change, and we want to talk to our neurologist and with the patient to say, hey, I'm noticing a change in this. I know this is really important for you to, let's say, do certain things. I can foresee that this becoming a problem. Let's act on it now so it doesn't become a problem. And having that tailored attack when we can talk at each visit of, okay, what's our goal? What do we want to do? And if that goal changes, how do we make adjustments and pivot from there? Concierge care allows us to have those long extended visits where we can really talk about, all of these plans and all of these goals as they change and how we can better get there. And I think another problem that we hear a lot in our patients that are limited with insurance is that it's hard to get a hold of your neurologist, right? So let's say we have a plan, and then next time we see our neurologist is 4 months from now. A lot of things can happen in 4 months. And what if you have a question you want to ask your neurologist, or something changed and things are a little bit different now? You gotta wait 4 months to talk to your neurologist, so that's challenging, right? And so the idea and the thought of putting concierge care in for Parkinson patients is, if something changes in the meantime, we're there to help you, right? So you can give us a call, and we can chat with you about, okay, we've noticed a difference, or maybe whatever we recommended, let's say, for most commonly I see is, let's try a new medicine, or let's change medicine, right? And we started on the change, but it's not going really well. We're having some side effects, or we have questions about it. We don't want you to wait for 4 months to tell the doctor that didn't work, right? We want to be able to talk to our neurologist as soon as possible so we can say, okay, well, that didn't work, let's pivot, right? Or why did we think it didn't work? Maybe something is interfering with it, right? And so having that kind of conversation along the way kind of allows us to not get bogged down by the care and having to wait for so long, so we can make real-time changes. And so that kind of comes down to my practice. So I'm part of Newport Neurology Associates, and our care is to provide personalized care so we can maintain the quality of life for each patient as long as possible, and to adapt as life changes. And so these are kind of the points that we talked about earlier. And the other thing I want to add is as we get older, we get more needs, right? And a big part of Parkinson's patients is we have a lot of therapy teams that we have to keep a hold of, with physical therapy, with exercise, occupational speech, all these things. There's a lot of things to keep track of. And so the great thing about having a concierge neurologist is that we're here to help you coordinate all of that, right? It's hard to find a good physical therapist who understands Parkinson's disease or a good psychologist who understands Parkinson's disease. And so our goal is that we go out and meet all of these teams and we vet them for you. And so you tell us that I'm looking for a physical therapist for balance, or I'm looking for breathing. And so we're able to connect you with the right resources. So it takes that stress off your back, right? So you don't have to try out a therapist for 4 weeks and feel like it's not working, I don't feel any better. So taking that out of the picture, so you can just focus on exercising and doing well and all of those good things is really helpful to have the neurologist help you do. And the great thing is that we also try to, with concierge care, we talk to each other. So you're not relaying. And that's one of the things we hear a lot from our patients, that before they convert to concierge care, that, you have to play a lot of telephone, right? My physical therapist said this, and my other doctor said this, and my psychologist said this, and you have to relay that all to the neurologist, and then you have to go back to the team and say, well, my neurologist said this, this, and this. Right? That's a lot to keep track of. And sometimes it's hard to remember all these things. And so it's helpful when the neurologist can just directly call all of them and be on the same team. All right. So that's us. And so we have different levels of concierge care. This just kind of gives you a brief overview of the kind of services that we provide. I'm going to leave it up here for a second and see if there are any questions so far about what concierge care means and why is it important for people with movement disorders to have a concierge neurologist.
So apparently I can mute everyone, but I can't unmute everyone. So if you want to speak, please go ahead and unmute yourself by clicking on the little microphone. Does anyone have any questions? Or if you feel more comfortable, you're welcome to type them in the chat. I'm monitoring the chat as well. Saeed, did you have questions?
Yes, I do.
Great.
Hi, everybody. This is Saeed, and my question is, at what point do we feel or do we realize or it's recommended to see a psychologist?
Oh, okay. That's a great question. So the question is, when should we see a psychologist? That really comes down to a discussion with your neurologist on what's right for you, right? So a psychologist's role is to kind of work through, the anxiety and different issues that we're having with depression or even motivation, or the stressors just having a chronic illness, because that's very common. And so if you feel like it would be something that'd be helpful and it's something you want to invest in, that's time when you should talk to your neurologist to get that referral in, because it does take a while to find the right fit for your psychologist and a while for it to start helping. Most of the time in the beginning, there's a lot of adjustment and learning about backstory. So if you're feeling that, maybe it's time, then it probably is time.
All right, thank you.
Of course.
Great question. Hari, did you have a question?
Yeah. If one, like I have doctors from different groups, neurologist or, for GI and other things, doctor from different groups. Can they be assembled together into one concierge group that will be treating me? That is because they come from different groups.
Yes,
so,
yeah. So,
or do they all have to be in the same group?
No, they don't have to all be in the same group. So that's actually a great question to segue. So I am part of a bigger group. So I'm part of a group called Newport Concierge Physicians. And my group has different specialists, but also a lot of family medicine and internal medicine doctors. And the great thing about that is having a good primary care doctor, so your GP or your PCP, they're really the one who's going to be championing everything. And so when it comes to specialists, a lot of the time is we see out of whatever specialty that we're in, but the great part about having a GP that's concierge is they oversee everything, right? Their goal is they have to keep everybody in check And so our PCPs who are concierge physicians, what they do is they're calling all the different groups, making sure everyone is on the same page and communicating with each other. And so that's the goal and the role of your PCP.
Okay, thank you.
Mm-hmm. Yeah. Any other questions?
Any
Yes.
other questions from our attendees? If not, I have a few.
Okay, I think Michael had a question.
Michael, did you have a
Yes.
question? Oh, yeah, thank you.
So I mean, it's pretty clear concierge means getting better care and more, but it's got to be more expensive.
Yeah.
Should you now? First of all, I understand that if so, maybe most concierge groups, you pay a fee at the beginning of the year, and then my question is, I mean, I understand you're providing more care. Of course, you're going to charge more.
What's the insurance coverage?
Yeah, what's the
versus-
insurance coverage for that?
Gotcha. Yeah, and that's a great question. And so every group has a different model, and so what they'll accept and won't accept is very different. But from what our group is, it's a cash-based fee because it's outside of the insurance. And we have different kinds of methods. So we can bill monthly, quarterly, or semi-annually, so you're not paying a large sum all the way in the beginning. And then we also try to work with our insurance plans. So some of the insurance plans have HSAs, or we can even write a super bill to help for you to submit with your insurance so that you can offload some of that cost. But a lot of it, we believe that the fee for service is the right thing, because with insurance is they're going to limit how much care you can have, right? They're going to limit how often you can see your doctor, how frequently and how long, and they can put barriers on what kind of treatment you can get, because they'll say, oh, this isn't approved and this isn't approved, right? And so the idea of concierge is we're breaking out of that. We're not letting the insurance give us limits of what we can and cannot do.
So
Does the concierge, I mean, does your group work with insurances though, or is that
Yeah.
back up to the patient to submit the insurance claim?
Yeah. So we do work with the insurances. So things that we can process through the insurance that we don't think will be a hindrance to the care, we'll do that, no problem. And we'll help you figure out what's the best plan, how to submit plans, so that we help you navigate that system, because the insurance system is also very confusing. So yeah.
Very good.
So can I ask a question about, since you
Yeah.
are being concierge, can you compare like the number of, let's say, a traditional physician who is in a traditional insurance-based practice, how many patients they have on their caseload annually versus someone who is concierge?
Yeah.
Maybe kind of give us some idea of how that works.
Absolutely. That's a great question. Yeah. So with our insurance patients, most insurance practices have to see a big volume, because the reimbursement is dependent on the insurance company. And as I'm not sure if everyone is aware, but every year the insurance reimbursement is going down. So that means physicians have to see more patients to get more reimbursement so they can meet their minimum, right? And pay their overhead costs. And so that's a lot of the reasons why, let's say, a general neurologist during an office day, they'll probably see 12 to 16 patients at a time. So if you're thinking from 8 to 5, 12 to 15, that gives you maybe 10, 20 minutes to see a patient, right? Most. And that's not counting when you come in, you get vitaled and check in and all that stuff, right? So really that face time is very short because the insurance limits on how often you can get, because you have to keep getting that reimbursement. And so the patient load is much higher. So in general, I think most of my colleagues who are in the insurance, they're seeing like a caseload of a couple thousand, right? A couple hundred to a couple thousand a year. So it's a lot of patients. Whereas in concierge, I can spend half an hour to an hour with my patients. My new patients get 1 hour, sometimes 2 hours to kind of talk about issues. And then I usually see maybe up to 5, 6 patients a day. 6 is kind of like the max because I like to have that time to talk to patients. We book the half an hour, but sometimes it turns to an hour because new things come up as we talk. But that concierge allows us that freedom to do that. We don't have to push a bunch of patients together. So Our caseload is still currently a moving target, but my max is probably going to be around 400, probably. But that's kind of still moving. It depends on the complexity of the patients. We may close earlier if the patient load gets higher, and that's the beauty and the freedom of having a concierge practice. We can adjust to our patients' needs accordingly.
So a summary might be, as from your perspective as a provider, that you get to practice medicine the way you love and intended to when you went to medical school versus what the insurance is dictating.
Yeah,
that's what
absolutely.
I'm hearing.
Yeah, well, that's what we believe.
But...
Yeah, and so I'll give you an example of my patients, right? So one of my patients, when we started, we were doing pretty good. So, we scheduled every 3 months because they're doing pretty stable. And then recently, one of my patients got sick, and then, they're just not doing so well. So I was able to schedule same day visit with them and then go to their home, check out to see how they're doing, because they told me I can't make it out to the office because I'm not feeling well. Okay, so I come to you, right? I don't want you to delay care because you're not feeling good. And then a week later, I was able to call him and check in on him and see how he's doing, right? And then they're feeling better. So 2 weeks later, they come to the office and we make sure everything looks okay, right? In the insurance system, first of all, they won't let you do home visits. And then second of all, the insurance won't approve of that many visits, right? They will make either the patient pay out of pocket or you won't get that reimbursement. And so it's hard to make that flexibility, right? If you already have 12 patients scheduled to see. I was able to say, okay, well, I'm going to spend a half day, just go see the patient. So that's kind of the flexibility that we can have, right? And then I have patients who are saying, well, I'm doing great. I'm going to space it out to every 6 months. And then in between, they may just call me or text me or email me that they have a question. One of them just messaged me recently and said, hey, I heard about this new thing with the sub-Q levodopa. What do you think? You think it's a good idea for me or not? And so, we chatted about it on the phone. I told him, if you want to come in, we could talk about it, the in-person visit. They were like, yeah, okay.
That's awesome. Thank you. Janice, do you have a question? Janice Dunlap, it looks like, is unmuted.
Yes. I signed up for a concierge group just recently, and they said they don't deal with Parkinson's disease. So it sounds like I'm in the wrong place. What would you say about that?
Yeah, so it really depends on the service. So if your concierge group is for concierge internal medicine, like for primary care, they deal with the general medicine aspect of things. And so their role is to kind of help you figure out, well, if we have Parkinson's disease, we're going to send you to a specialist, and then help direct that care of what match of a specialist that you need.
I already have a specialist. It
Okay.
sounds like, how would I deal with you and my specialist already?
That's a great question. And so there are no clear guidelines of how that works, and every specialist team kind of works differently. So some concierge groups will tell you, we only work within our system, we don't refer out. Some groups will say, we're happy to play ball. For our group, we're happy to play ball with everybody. So if you want concierge services from us for neurology, and then you want to keep your primary care concierge service, that's totally fine with us. And we can chat with each other and see how to coordinate the care. But every team is a little bit different. So talking with your concierge group to see what their roles are and how they split up the care or how they unify the care will be really helpful.
So as a follow-up question to that, Dr. Chen, she had an excellent question. Would you recommend that when people are looking for a neurologist or movement disorder specialist, that they actually interview them or to see if it's a good fit? Because is that okay to copy? How do you suggest people find as far as that initial contact? Do you have to set up an appointment to interview, or can you do an interview over the phone, etc.?
Yeah, absolutely. That's a great question. Finding the right fit means everything for all of our patients, right? And so what we recommend is having a first visit with movement disorders, because a lot of things you can't really see on the video, right? And you really have to see the patient in person to get a feel of how they're doing and to examine them, because there are some exam maneuvers that I can't do over the video. Right? So with movement disorders, really you should meet with your neurologist in person for the first time. And I would just be candid, said, I'm looking for a movement disorder neurologist that fits my needs. Let me tell you my story and my approach and what I would like, and see if that's something that you agree with and aligns with your practice. If it works out, then okay, let's proceed. If it's not, then, find another second opinion, third opinion, whatever you need to find the right fit for you. Because the way I see it, right now we don't have a cure for Parkinson's disease. It's around to stay. And so your neurologist is going to be there, part of your life for a long time, if everything works out, right? If you like your neurologist, so we should find the right fit, right? Because you're going to be working very intimately and closely with your neurologist as times go on. So if it's not the right fit, then gotta find a new one.
Great. Let me see. Does anyone else have any more questions? If not, I do have a couple more.
Sure.
I don't want to, and also don't forget, you're welcome to put something in the chat if you're shy about speaking. If you could go back to the previous slide, I had a question of your very first group you had at the bottom, dosing clinic. Could you explain what that is?
Yeah, so that's something that we offer for the complete concierge package patients. And that kind of varies depending on what the patient needs, but it's basically an extended day where we discuss with our patients different things they need. So sometimes patients will tell me, I don't know what my medication does. I'm not sure if it's helping. Or they tell me, I feel like there's a side effect, but I don't know, I can't describe it. I just feel off. I feel weird. I can't tell you what it means, but I just don't feel good on medicine. And so having that extended visit will be helpful, is what I tell patients is come in, we'll do an exam, we'll have you take your medicines, I'll watch you, and then see what happens. And that kind of gives us an accelerated view of what's going on. Because sometimes you tell doctors that, I don't feel good, or I can't tell the difference, but when we're looking at you, we can say, well, I see a benefit, or I see something change, that maybe it's not enough for you to really feel something. So it allows us to experiment in the safety of an office, because then you don't have to worry, well, what if something bad happened? Because your doctor is right there. So that allows us the opportunity to check to see if things are working, or if we want to experiment or try different kind of therapies without having to worry about something else going awry.
Thank you. That was very helpful. I also want to just point out to everyone that in her bio, Dr. Chen has indicated that she has a special interest and special training in deep brain stimulation management. And could you elaborate a little bit more on that? Maybe not everyone knows what DBS is and what the management aspect might be and that sort of thing.
Yeah, absolutely. So deep brain stimulation has been around for quite a while, actually a couple of decades. And what it involves is placing an implant into your brain. So it is brain surgery. And what it allows is it helps modulate a lot of the symptoms relating to Parkinson's disease. Now, it doesn't fix it, it doesn't make it go away, but it helps improve a lot of the symptoms. And so it is an option when we're hitting a lot of roadblocks with our medications. So maybe the medicines we're taking, we're having side effects, or if we're taking it super frequently, like every 2 hours, and that's not acceptable to our daily life, that's when we can consider deep brain stimulation as a way to reduce the medicines we're taking or reduce the side effects from the medications. So really the way I see it is deep brain stimulation is another tool in the toolkit of how we treat Parkinson's disease. We've got meds, we have exercise, we have a lot of things. Deep brain stimulation is just another tool. When I went to Florida to do my training, they had a lot of specialization in deep brain stimulation. So we got a lot of exposure to that. So that's something I'm super familiar with. But the way I see it, I think it's another tool that we have to consider. For some patients, it works great. For some patients, that's not what they want, right? So it really should be a discussion with your neurologist about what you're looking for, right? And that's a process. So brain surgery is permanent, right? So it's a big deal. And so we want to talk about, well, would deep brain stimulation be an option for you? And what would you want to achieve out of it, if that's a reasonable goal or not, or if that's something that maybe for your case, probably too high risk, right? And then after that, the great thing about deep brain stimulation is you can program it, right? So it's adaptive, which means, let's say we make some changes and you say, oh, this is working great, but now I'm having these side effects. Okay, so we can make some adjustments to your programming so you can have less of those side effects. So it's nice because you can adapt as the disease progresses or as you change, right? So if new symptoms pop up, then deep brain stimulation can help adjust with those symptoms too. So that's the beauty of deep brain stimulation. And that's why I like it, because you can adapt it. But it does take a lot of face time with your doctors and your neurologist and your other team, because it is brain surgery. So we want to make sure everything else is healthy and okay to undergo big surgery. But most of the time when we undergo deep brain stimulation, it involves very frequent visits. So initially, after my patients get deep brain surgery, I see them every month. So it's pretty regular.
That's awesome. That's great. You know, we talked a
Yeah.
lot about what the neurologists and the movement disorder specialists do for our people living with Parkinson's. What can, if I, let's say if I was coming in to see you as my physician with Parkinson's disease, well, how can I best prepare for my visit with you? What do you as a doctor want to hear from me or see from me? And how can I make our visits optimal based from my end as a patient?
Yeah, I mean, that's a great question. And it's something that actually I also talk with my patients about in terms of expectations. So before each visit, what I think is helpful is sitting down with your loved one or with your care partner, and think about what are the things that are going on in my life that are most bothersome to me, right? Because we can have a lot of symptoms that are going on, but we want to make sure we talk about the main things that bother us, right? We never want to leave a visit going, oh, I forgot to talk to the doctor about this, right? Because oftentimes we remember things that are most recent to us, right? And so when your doctor tells you, okay, so how can I help you today, right? Sometimes what we remember is the thing that happened yesterday, but it wasn't really a big deal, but it's the one we remember. So it's the one we're going to bring up, right? So you want to prepare and do your homework before your appointment. Sit down, let's organize. What are the top things we absolutely want to address during this visit? Usually I tell my patients top 3, right? So the top 3 things that bother you, that impact your life, your day-to-day, right? We make sure we touch those. Then after that, you can come up with a list of other things that are bothersome, but you know, they're not the end of the world, right? Not as urgent, right? And so you work through that list. So these are the top 3 things I want to get done today. If we have time, I would love to talk about these other things, but if we don't, we can table that for next time, right? And so having that organization is super helpful, so that your neurologist knows how to guide your care, right? Because everyone has different needs and different goals, right? I have patients who have terrible tremors, but the tremor is not what bothers them. It's the speech that bothers them, right? And I won't know that unless my patient tells me that, right? If I see the tremor, I'm going to ask, how's your tremor, right? Or if I hear that they're having speech problems, I'm going to ask their speech. But it's up to you to tell me that, you know what, this is a problem, but I'm not worried about it. Let's talk about something else, right? So really, it should be a discussion. Yeah.
Thank you. That's excellent. Well, does anyone else have any other questions for our guest speaker? Trying to see here. I don't see if anyone else has their thing are muted. It looks like we might be good. Janice, did you get all your questions answered? Because you're still unmuted. I just want to make sure I'm not cutting anyone short.
Hi, Trish. Can I add some question? Another question?
Of course,
Yes,
Jose.
absolutely.
Yeah.
Is that Jose?
Doctor, correct me if I'm wrong. At the meeting with our specialist, in this case that we have to lead the doctor for the treatment or for the approach to that meeting. It's not that we have to, because usually when you go to see the doctor, you sit down and you expect to be directed by the doctors, and maybe that happens in other areas, but not in this one. So we have to be prepared to let the doctor when we go to visit him, right?
Yes, absolutely, because you're the one who's living your life, right?
Yeah.
So generally what happens is the specialist will direct you if they don't hear anything else, right? Because most specialists are going to go by, okay, what are the things that are most dangerous to the patient that I want to make sure that gets covered? And then we ask the things that we know typically bother patients, right? But you want to personalize your visit because it's about you. And so if you don't bring up something that bothers you, the specialist is not going to know, right?
Yeah, thank you. So this is the
Of
new
course.
approach to the visit of the doctor and patient, unlike the other area.
Yeah, that's what I think anyway, because Parkinson's disease is so big, right? There's so many symptoms that can happen in Parkinson's disease, and it affects us all very differently, right? And so we're not living your life. So there's no way we can know how it impacts you and how bothersome it is, right? I have patients who have a little bit of tremor, but they're a calligrapher. So that tremor is absolutely horrible for their life, right? But I wouldn't know that if the patient didn't tell me that, right? I mean, I would ask them, but you know, it's helpful when patients bring that up and say, hey, I'm having this issue. It really bothers me. I have a couple of patients who, you know, their tremor is there, but they're not bothered by that as much as their balance issue, because that affects their golf game. And that's what bothers them, right? Because they want to be able to play golf, right? So it really comes down to thinking about, okay, what matters to me, right? I have these symptoms, but which ones actually really do affect my life?
Okay, thank you.
Of course.
Excellent question. You know, another comment that I might have from somebody who is an allied health professional as a physical therapist and has worked for many years in adult neurology. I could say that doctors all mean well, but they just don't have a lot of time for that discussion and that communication. And the idea of a physician that actually has some time in their day to communicate and connect and really talk about what we see, because in physical therapy, we'll see people often many more hours than a physician will.
Absolutely.
Actually take the time to be able to be heard as a health professional is huge in that continuity of care, and something that has been a challenge in my practice in the past. So I just want to say from somebody as a allied health care professional working with people with Parkinson's, that's a really positive benefit of a physician who has less patients every day.
Yes, absolutely. And it takes a village, right? It really takes a village to take care of a Parkinson's patient. Well, as with anyone with chronic illness, and as we get older, we'll all get chronic illnesses. But it's really helpful to have a team that talks to each other, right? Because we've got a lot going on as it is. Your team should be talking to each other to reduce that workload for you. So, you know, everyone has different specialties. And what I love is having that relationship with my physical therapist, my occupational therapist, because they're, like you said, you guys see them a lot often than I do, right? And sometimes you'll notice things much sooner than I will. And it's great because having that relationship, my therapist may call me and say, hey, so-and-so was at the therapy today, and they were kind of like, can you just check in on them? And it's great, right? Because you can have that expertise and conversation.
Great, thank you. Well, your day is very full and busy. You're very a busy professional. We want to be respectful of that time and respectful of our attendees' time as well.
Sure,
I want to
of
thank you. I was
course.
going to ask you, how can they reach you and your practice if they would like to reach out for further questions or maybe
Absolutely.
to pursue some sort of professional arrangement? So thank you for putting up this slide.
Absolutely. All right. Well, I appreciate everyone attending. I hope we clarified some things and we learned some things. Our door is always open. And I hope everyone has a great rest of the day and a good weekend.
Well, thank you so much. And if everyone
Absolutely.
wants to give Dr. Chen a clap, she can see you guys. So a round of applause.
Thank you, everyone.
Unmute. We want to thank you so much. That was very informative. We appreciate your honest and your candor and your excellent information that you've presented and taking the time out of your day to do this. So I really appreciate that. And you're being so proactive as well. And we just thank you for all your service to all of us in this profession and those of us living with Parkinson's and movement disorder specialists. So thank you very much. And everyone, thank you for attending the Pep4U Education Hour. We will have another education hour coming up in March, and it will be geared a lot towards the activities and strains and benefits and joys and living with somebody or being in the life of someone with Parkinson's disease, presented by somebody who not only has a healthcare background, but also lived that role themselves. So it looks very, very promising and very exciting. So more to come on that. So thank you, everyone. And you guys have a great day.
All right. Have a great weekend, everyone.
Bye-bye.